The same holds for cranberry juice and other juices high in vitamin C. The bacteria that most commonly cause bladder infections don't like an acid, sour environment. That is why these remedies work most of the time quite well. Hello, welcome back to Gyno Info. Or if this is your first time, just welcome. I'm so glad you discovered us. In this podcast, we discuss common gynecological problems in a frank and open way that normal, everyday women can understand without having to use a medical dictionary. Today, we're going to talk about what you should think of first when it hurts when you pee. We're going to help you try to figure out if something is a bladder infection or more likely a vaginal infection, because both can cause pain with urinating and peeing. And we're also going to try to help you figure out if this is a real emergency like a kidney infection and you should go to a clinic right away. So when it hurts when you pee, the most important question to ask is, where does it hurt and when does it hurt? If it stings on the outside, as soon as the urine comes into contact with your crotch, your outer genitals, your vulva, those are all same words for the same thing, it's more likely to be a vaginal or a vulva infection than an actual bladder infection. We're used to thinking that pain with peeing is always a bladder infection. But when urine, which is basically salt water, comes into contact with open herpes sores or a skin on the outside of your crotch that's irritated and red and inflamed by a major yeast infection or some other vaginal discharge that causes the skin on your crotch to be damaged, it burns, it stings, it hurts. And still, it's not a bladder infection. It's because your vagina produces an irritating discharge, or you have a yeast infection, or even herpes sores, as I mentioned. There are also some STDs, sexually transmitted diseases, that infest and grow in the urethra. The urethra is a tube that leads from the bladder to the outside and opens right above your vaginal opening, right below your clitoris. One such STD, sexually transmitted disease, that typically can be found in the urethra is chlamydia. When chlamydia grows in the urethra, it causes an inflammation, a so-called urethritis, and it hurts when you pee. Chlamydia actually can cause similar symptoms in men, but it may also cause no symptoms at all in either men or women, especially early on, so people pass it on without knowing that they have chlamydia. So again, when it hurts on the outside, it's most likely not a bladder infection. An infected and inflamed bladder generally causes a more dull, constant, deep pain inside behind your pubic bone. The bladder is a hollow muscle, kind of like a balloon. When it empties, it does that by contracting the bladder wall and the muscles in the bladder wall, which then dials up the pain from a dull to excruciating at the end of peeing. So with a vaginal infection, it hurts as soon as the urine touches the inflamed skin on the outside of your crotch. With a bladder infection, the pain is worse at the very end of peeing. And even though it hurts emptying the bladder, an infected, inflamed bladder prefers to be empty rather than stretched out when it fills again with urine and expands, which makes the irritated bladder walls even more irritated when they stretch out. That is why a major symptom of bladder infection is that you have to pee all the time because your bladder wants to be empty, even if there are only a few drops to come out. Doctors will call that frequent urination, so that is another important term to use when communicating with office nurses and doctors. Painful urination and frequent urinating is in small amounts. Those are the key words. But you can also just say, I have to pee all the time and not much comes out and it hurts peeing. That says exactly the same thing and is totally clear. But it's really important you tell what symptoms you have and when they occur. Another pretty sure sign that you're dealing with a bladder infection is peeing blood when you don't have your period. If you have your period, there's always a little bit of blood that can drip into the toilet bowl when you pee, but this blood when you are not on your period. You may notice just a very light tinge of pink color or a deep red, depending on how much blood is present. Eating red beets also makes urine red, but then you would know what you ate and you wouldn't have any pain and all the other symptoms. So don't get alarmed if you just ate red beets and have dark urine. It is generally a sign of a type of bladder infection that you should seek immediately attention for, and not just first try over the counter and house remedies. If you're peeing blood, then it's probably an E. coli infection, and most often these don't go away by themselves. You will need antibiotics, so you should go right away to a clinic. Also note that any visible blood in the urine, whether it's dark red, light red, or flakes of blood, is never normal, whether it hurts or not, unless, again, it's clearly related to your period. It should never be ignored when you have blood in the urine, and it's a good reason to make an urgent doctor's appointment. It could be a sign of cancer even. It could be cancer anywhere where the urine is produced and passes by, from the kidneys to the ureters, the tubes that lead from the kidney to the bladder itself, or the urethra, the tube to the outside. It doesn't have to be cancer, but there are also less severe conditions that can cause painless bleeding in the urine. But cancer has to be ruled out in doctor speak. Ruled out means you prove that it's not something. And in this case, you rule out cancer, so you have to prove that it's not cancer, because that would be very bad to miss. So now we have talked about where does it hurt. Outside, more likely not a bladder infection, but a vaginal or a vulva crotch infection caused by bacteria or a fungus such as yeast or a virus such as herpes or some other STD. Pain deep inside, behind your pubic bone, deep in your pelvis, points to a urinary tract infection. These are generally caused by bacteria. We also talked about how important it is when it hurts the most. Immediately when the urine touches the crotch, points to vaginal and vulva infection. If the pain is worse, and the very worst at the end of peeing, when the bladder contracts, that points to a urinary tract infection. I have now used the word urinary tract a couple times. Urinary tract infection, or UTI, and I owe you some definitions. The urine is produced in the kidneys as a way of washing out waste products from your body. It then travels from the two kidneys where it's produced, one on the left and one on the right, through the two ureters to the bladder. Ureters are the tubes between the kidneys and the bladder. And from the bladder, it goes through the urethra to the outside in the toilet or behind the bush. This is called the urinary tract. An infection anywhere in the urinary tract is called a UTI, a urinary tract infection. UTIs are also divided into lower UTIs, which is limited to the bladder and is often called an uncomplicated urinary tract infection. An upper UTI involves the kidneys and actually most often started out as a lower urinary tract infection in the bladder, and then it travels up from the bladder to the kidneys. An upper UTI in the kidneys is something more serious, and I'll just talk about that in a minute. The term urethritis, an infection and inflammation of the urethra, the tube from the bladder to the outside, is generally only used in relation to bacterial sexually transmitted diseases, to bacterial STDs like chlamydia, and most often is a combined infection of other parts of a woman's genitals, the cervix, or even the throat if there was oral sex. It's generally not just in the urethra. But a good STD screening should include a swab from the urethra, which is very uncomfortable, but not deliberate torture. It's definitely necessary. A lower urinary tract infection, lower UTI or bladder infection, is generally relatively harmless, though painful, and often can cure themselves without any antibiotic. The bacteria are washed out and the body's immune system starts fighting them and then wins. And then it's cured. That is why you should drink a lot when you suspect that you have a bladder infection. This is what people have done for centuries and all they could do before there were antibiotics. Drinking a lot and flushing out the system and washing out the bacteria so there are fewer left and the immune system has an easier job killing them off. It is also currently drinking a lot is the first line recommended treatment for uncomplicated lower UTIs. Lots of fluid plus an anti-inflammatory pain medication such as ibuprofen. Bladder teas and other herbal remedies work mainly by flushing the urinary tract. You drink them, you have to pee, you flush everything out. But they can also create an unfavorable environment for the bacteria that are causing the infection, so they cannot really grow well and multiply and are easier to be flushed out. The same holds for cranberry juice and other juices high in vitamin C. The bacteria that most commonly cause bladder infections don't like an acid, sour environment. That is why these remedies work most of the time quite well. Antibiotic treatment is only indicated if the symptoms don't get better after a few days, or if you're peeing blood, or when you develop signs of an upper tract infection, of a kidney infection. Then you have to act, and act today and not wait a week. An upper UTI or complicated UTI or kidney infection or pyelonephritis in doctor speak is altogether different and needs a prompt visit to a healthcare provider. And if you can't get an appointment with your GP, you need to go to an urgent care center or an ER. Untreated kidney infections destroy the kidneys over time. You only have 2 of them, and you need kidneys to live. Kidney failure is a deadly disease, or at least a reason to be going on kidney dialysis, which ties you up for several hours, several times a week, and really changes your life drastically. Symptoms typical of kidney infection is, in addition to the bladder infection symptoms we've already discussed, and most kidney infections start with a bladder infection, is either one or both-sided mid-back pain. The kidneys are located about at the height of your belly button, but on the back. And if somebody knocks on the back to the left and right of your spine, it's sort of midway up your back, and that sends stabbing pain, then you probably have a kidney infection. The doctor will probably do this knocking test to show that you have a bladder infection, so be prepared for that. But you can do it yourself at home. And if that really causes a lot of pain, you're almost guaranteed that this is a kidney infection, not just a simple bladder infection. Fever with and without chills, headaches, and generally feeling very ill are the other symptoms of a kidney infection. Terms that will be helpful when you use them when communicating with the receptionist to get a right away appointment, or then talking to your healthcare providers, are pain with peeing, having to pee often, blood in the urine if you have it, and back pain, one or both sides, fever, headaches, feeling very ill, chills. It is also essential that you tell them if there is any chance whatsoever that you also have an STD, because you could have both a bladder infection, or kidney infection, or a sexually transmitted disease. You can have both things at once. And that would need to be considered in the choice of antibiotics when they treat you, or not using an antibiotic if there's no chance at all. So if you have a new partner or more than one partner and suspect that at least one of your partners has more than one partner, and especially if you're not using condoms, it is time to speak up when you see a doctor. You need to be tested, because most of them are curable. But if you wait too long, you have a lot of negative consequences. I also need to quickly say something about what causes these bladder infections. One of the most common reasons to have a bladder infection is actually intercourse, and frequent intercourse and a lot of intercourse. That's why we sometimes speak of honeymoon cystitis. when you have a lot of sex in a new relationship, or in the olden days, that used to be your honeymoon. It can still be your honeymoon that you're having a lot of sex for the first time, but having a lot of sex with a penis going in and out of the vagina, that can massage bacteria that are on the outside normal, but on the inside of your bladder, they're not normal. And during the act of having sex with a penis going in and out, they can get massaged up into the bladder, and then they can get hold and cause bladder infection symptoms. That's one of the reasons you should go pee before and after sex. Pee before, because any bacteria that are sort of on the way crawling up your urethra up to the bladder get flushed out. And then afterwards, any of them that were being massaged up your urethra towards your bladder get flushed out again. And sometimes, if you tend to have a lot of bladder infections, there are other options to prevent chronic reinfection of your bladder that we'll talk about in some other episodes. There's a vaccine that is available in Europe. I have to research if it's available in the US as well, or in Canada, where you can get it. There's other things you can do, and we'll talk about them later. So that brings me to the end of the episode. I hope you learned from today's episode how to figure out whether you have a urinary tract infection, or more likely a vaginal or vulva problem. The most important sign being when and where it hurts, and how to know when it's likely only a lower urinary tract infection that you can treat yourself, or at least try to, and when it's more likely that it's a kidney infection that needs prompt medical attention. I also discussed with you what you should say to make it more likely that you get an appointment right away, and what to say when you get there, so you have a better chance of getting the right diagnosis. And that's all there is time for today. I hope you found this useful, and will tune in next time to Gyno Info and tell your friends about it and give us a few likes. More about vaginal infection and STDs and how to diagnose and treat them we will discuss in a future episode. And remember again, if you have questions, you can write to us at questions@gynoinfo.net. Again, that's questions@gynoinfo in one word, .net. See you next time. This is today's life tip. Stop and smell the flowers. Take a moment to connect with nature and breathe through fully and consciously. You feel some of your life stresses fall away as you breathe out. And if there are no flowers around, a bakery or a coffee shop smell will have to do. It works. Just as long as you stop and breathe and give your full attention to whatever you are smelling. Doing it with someone else may even be better. Until next time, thank you for listening, and remember that you and your health are super important and deserve your full attention. Don't ever put off contacting your doctor because you're scared or embarrassed when something feels wrong about your body. Doctors are here to help you and not to judge you. And also, regular well-woman visits are always a good idea that you should make time for. You deserve it, and you owe it to yourself, and you owe it to your body and your health. This podcast is part of Pride House Media, hosted by me, Dr. Burki, produced and edited by Josh Rosenzweig. Original music composed by Nell Balaban. If you enjoyed this episode, please subscribe wherever you listen to podcasts. And while you're there, leave us a rating and a review. It really helps others discover the show. Stay connected and join the conversation by following me on Instagram and Facebook at GynoInfo, and on LinkedIn at GynoInfo Podcast. Remember, any questions that I answer or information that I give you on this podcast are to be understood as information only, not treatment of your medical problems. While I'm a very knowledgeable gynecologist, I'm not your gynecologist who has talked to you and examined you personally and is therefore actually able to treat you. So please consult your own healthcare professional with any medical questions or concerns.